Well, welcome and good afternoon and good evening to those of you who are on the East Coast. I'd like to welcome you to the third session of our 7th annual Touro University, California Social Justice and Public Health Speaker Series, hosted by the Public Health Program. My name is Deirdre Wilson, and I am a professor and chair of the Community Action for Health concentration in the Public Health Program at TUC, and also the co-coordinator of the Social Justice and Public Health course, along with Dr. Gail Cummings. I'll be the moderator for today's session. As a follow-up from our series last year, we focused on the public health impacts of COVID-19 and police violence. This year, the series examines those issues broadly, with an emphasis on mental health implications and mental wellness, and also the complex intersections between the COVID-19 pandemic, structural racism, and inequities in mental health through the public health lens. In this third session of the series, we will examine the implications of police violence, structural racism, generational trauma on the mental health well-being of people of color. And we have three amazing speakers who will present from their perspectives the foundational issues related to generational and racial trauma that is at the root of a lot of the inequities in mental illness among people in our country. But before we begin with our session, as usual, we would like to provide a land acknowledgement. And although we're meeting virtually, I would like to proceed with this acknowledgement that recognizes that the land itself is not just a space that bodies occupy, and all of us, no matter where we are currently sitting or standing, we reside on territory that is indigenous territory. Touro University itself is located on Mare Island, and in that we acknowledge that Mare Island is on a site of the traditional land of the coastal Miwoks, the Susunis, and other Patuan people, past and present. And we honor with gratitude the land itself and the people who have and continue to steward it through generations. Again, I would also like to express gratitude to Ms. Kim DeCampo from the California Tribal Partnership, one of our program's amazing community partners, Public Health Program Advisory Board member, and a champion of the Social Justice Speaker Series. It was through her recommendation and introduction to Ms. Michelle Maas that we have the opportunity to include her perspective in today's series. So today we will provide an overview. We'll have a panel discussion. We'll also have a time for questions and answers. And as usual, we will also provide continuing medical education credits to those who are interested. And you'll see this information on the next slides. We are recording this session. And if you are interested in the continuing education credits, please log on to www.eads.com and place this activity code in the system. I will also place this activity code in the chat. So now I'd like to begin with an introduction of Drs. Walker, Ms. Michelle Maas, and also Dr. Liu. We are excited to have invited Dr. Rheeda Walker to participate in our speaker series. She is an award-winning professor of psychology, a fellow in the American Psychology Association, and a leading scholar who has published more than 60 scientific papers on African-American mental health, suicide risk, and emotional resilience. Dr. Walker's impact has expanded beyond academia, and she has quickly become a fan favorite with the release of her first book, The Unapologetic Guide to Black Mental Health. Dr. Walker debunks myths about mental health, builds the case for psychological fortitude, and delivers practical advice for those in everyday life. Her charismatic vision and practical approach to life's challenges has led to numerous appearances on Good Morning America, The Breakfast Club, and NPR, among others. She's often quoted in major publications such as the Washington Post and Los Angeles Times. Dr. Walker's eclectic mix of experiences positions her well to achieve her ultimate goal of bringing culturally informed psychological fortitude to both professional and lay audiences. So again, thank you, Dr. Walker, for participating. I would like to proceed with introducing Miss Michelle Maas. Miss Michelle Maas is an enrolled member of the Red Cliff Band of the Lake Superior Chippewa Indians of the Great Ojibwe Nation and Three Fires Confederacy. Ms. Maas works as a licensed clinical social worker in San Francisco at the Native American Health Center. She has extensive experience in providing psychotherapy and early intervention prevention counseling to individuals within the Native American and Alaska Native communities, as well as non-Native peoples. In her practice, she integrates her understanding of Anishinaabe culture with Western evidence-based and practice-based evidence. Michelle has been an invited speaker at local, national, and international conferences and has extensive experience in presenting and facilitating workshops on issues pertaining to the Native Americans or to Native Americans that focus on trauma, complex trauma, historical and intergenerational trauma. Thank you so much, Ms. Maas, for participating in this week's session. And last but not least, Dr. Michael Liu, who is the Dean of the UC Berkeley School of Public Health and has a deep-rooted passion for health equity and social justice. He has dedicated his research to the development of a new theory of the origins of maternal and child health disparities. He earned his medical degree and master's degree in public health from UC Berkeley and UCSF Joint Medical Program. He's also led the efforts to expand the undergraduate program at the University of California, Berkeley, and the MPH curriculum, and to strengthen doctoral training. Dr. Liu is also the director of the Maternal and Child Health Bureau for the U.S. Department of Health and Human Services, which serves more than 57 million women, children, and families. And during his tenure there, he transformed key federal programs, launched major initiatives, and reduced maternal, infant, and child mortality, and was awarded the Herbert H. Humphrey Award for Service to America. Thank you, Dr. Liu, for participating. And so now I'm going to turn over the session to Dr. Rheeda Walker.
Wonderful. Thank you so much, Dr. Wilson, for that introduction. And also, good evening to my fellow co-conspirators this evening, as well as everyone who's there in the audience. Can you all see my slides there? Yes, okay, very good. Thank you. Thank you so much for confirming. Actually, I need to be in presenter mode. And so yes, now we are in presenter mode.
So we're going to change course, and we will have Ms. Michelle Maas present, and she and Dr. Liu will participate in a panel, and we'll be able to get additional perspective from both of them on generational trauma and their experiences of racial trauma and their suggestions for strategies and policies that we can put in place as practitioners, clinicians, allies, and advocates to support the mental health of our population. So I'd like to invite Ms. Maas to share her screen.
Deidre, I just would like to ask, can we take a 2-minute break? And then when we come back, I'll share my screen.
Sure.
Thank you so much.
Now, in the meantime, while we're waiting for Ms. Maas to pull up her slides, I do recognize that you all had additional questions, and there's some of you who also requested copies of the slides. Unfortunately, we can't provide copies of the slide, these particular slides, but if you are interested in some of the information that is presented here, we will have an edited version of this presentation that won't be inclusive of everything, but that will provide some further information for you. So if you have need of that, please send an email to me. I will put my email in the chat, and I'll be happy to provide a link to the video of this presentation.
Oops. Thank you, Dr. Wilson, and thank you for having me. I'd like to extend my deep gratitude for being invited to speak today. It's an honor and a pleasure to be here speaking, and particularly to be speaking on Native American issues that are often overlooked. I'll just briefly reintroduce myself. My name is Michelle Maas. I'm an enrolled member of the Red Cliff Band of Lake Superior Chippewa Indians, and we call ourselves Anishinaabe. I work as an LCSW at the Native American Health Center. I have 20 years experience working with individuals, families, and communities at a macro level and at a micro level. So I'm happy to be here, and thank you all for listening. I do want to just acknowledge that the University of Touro University sits on Ohlone land, and I just wanted to make that, may have been acknowledged in the chat, but I wanted to verbally acknowledge that as well. So, oops. So we can all read. I just wanted to, I'm not going to read each one, but this will be how policy, we'll look at how policies have impacted American Indians at the and with mental health. And we're going to review how these policies shape social structures and individuals. And finally, we're going to look at social justice matters and how they also contribute to mental health. Finally, we'll be looking at some steps for change, first steps for change. Oops. My screen is stuck. Let's see. Well, my screen is stuck, so I apologize for that. I don't know why that's happening, but the first thing we're going to talk about is I want to talk about exclusionary policies. And I'm going to read a quote that I actually spoke at the Human Rights Commission section for Native Americans back in 2007. When we believe or internalize the message that our government officials send us indicating that we don't count, we're not important, then drugs, alcohol, homelessness, lack of self-esteem, lack of confidence, and lack of self-worth are the result. So I'm just going to have to go through without sharing my slides. I'm not sure what I'm doing wrong. I'm just kind of frozen here. Okay, there we go. So just a review on historical trauma, that it's cumulative, emotional, and it's a psychological wounding that happens over the lifespan and across generations, emanating from massive group experiences. And we'll see how American Indian policies have contributed to from wars to the reservations to prisons. More recently, American Indians didn't become citizens until 1924. We'll see how it impacts us financially, these policies, and we'll we have this psychological belief that we can't participate. That's an internal negative cognition that often we have. Just a brief word about complex trauma. I like to look at intergenerational trauma as complex trauma, that it's an interpersonal trauma, and it involves situations where the person who is traumatized cannot escape from the traumatic experience because he, she, or they are constrained physically, socially, or psychologically. So during reservation period, we had physical constraints. We were killed if we left the borders. Socially, we make our own, and society makes constraints. No Indians allowed. And then as we're in poverty, we get a hopeless outview and a feeling of not worth it. And that impairs us psychologically to try to move forward. So a little bit about the sites of social change and shaping. And this happens at different levels. I'm going to start out with the systems level and work down to the micro, the individual level. You can see how that tree is struggling to hold on because it's at a harsh environment. So at the systems level, from the beginning of contact, we've had exclusionary policies that have started off with war from the beginning. These have it's just an example of trauma from generation to generation, when your people are killed, when your families are killed, when you lose your social roles, as what happened with wars and removal, with Native Americans. And also what happens is there's a demonization that takes place. And we're probably, many of us are aware of this, that when there's a war or an enemy, the government tries to demonize the people that they're against. We've seen this in, we see this more recently with Donald Trump in the Asian community, and with the Latino community, how he was so strong against strong against the Latino community with the border wall, make the wall, people are taking your jobs. And with the Asians, we see this playing out in attacks. It's happening all over here in California. And that is rooted in not only policies, but demonization that takes place at a federal, state, and social level. I'm not going to talk about all of these, but we had a removal policy. The government enforced removal. That was from Andrew Jackson, whose idea was if you got rid of the Indians, all the Indians east of the Mississippi would be moved to the west side of the Mississippi. And then the Western civilization and the settlers could take over. The problem with that is that people were moved, and they were moved into lands that was other Indian territories. And so there was some problems with that. Also, they had to adapt to the environments there that were quite different than the environments they had in the East. There were some tribes that negotiated with the federal government and were able to stay. And I'm happy to say that we had a chief buffalo back then who himself and a lot of delegates went to Washington, D.C. to negotiate for the land base that we now have on the 7 reservations up in Wisconsin for Ojibwe people. We're going to talk a little bit later about boarding school and how this impacts us through the present, relocation, and how that enticed natives to come to San Francisco, and one of 7 cities. And when they were here, they were promised housing, they were promised a stipend, they were promised job training. Well, some of the job training took place. They didn't have any money, and many of them had turned to alcoholism. But on the positive side, we are resourceful people, and many of our urban Indian centers were created out of this time. So it's interesting with the federal government that we also have the government implementing policies that correct old laws. So in 1978, they passed the Indian Freedom of Religious Freedom Act that basically allowed us to practice our ceremonies, which were outlawed for several years, even in spite of the First Amendment that allows freedom of religion, because we weren't considered a people. We didn't become citizens until 1924, which isn't less than 100 years ago. American Indian Grace and Protection Act and repatriation was passed so that we could get the bones of our ancestors and that were living in the university halls and museums. Finally, the Indian Arts and Crafts Act that was passed just in 1990, so that non-Native peoples could not pass off Indian art and say that it was Native American and that they made it if they were not Native American, because of course that took funds away from our people. So moving to society, how society is shaped historically through the present. And when you have wars and removal and exclusion, you learn to believe, you learn to first not trust, and then you also learn that you're not a part of. And this affects not only Indian people, but affects the broader society. And then we see the demonization with up until the 1980s, and I don't know of any place recently, but I would imagine so in rural locations. Up in the Pacific, up in the Great Lakes area, we saw signs that were posted, kill a squaw, save a fish, during our treaty rights, our fight for treaty rights in the 1980s. When, as I mentioned before, when we have wars, we're demonized. I want to talk a little bit about boarding school and how that impacts us and broader society. Broader society, the government made the policy to remove us, and if they couldn't remove us, then they were going to remove the Indian in us. And then hence the policies of boarding school, where my friends and relatives were exposed to horrific traumas. At some point, in some boarding schools, the government officials there or the priests and nuns forced the children to scrub their skin so that it would become lighter. Well, of course, that created a lot of self-hate, and not to mention the abuse that created survival and maladaptive survival mechanisms. I talked a little bit about relocating to the cities, and once we got to the cities, we're invisible. And when you're invisible, you don't have a voice. And you're in survival mode, as Dr. Reed spoke about. And when we're in survival mode, we're just doing what it needs to stay safe and have basic needs of life. And I just put Public Law 280 in here because that's a law. If you're not aware of that law, it's a law that says it transfers the federal responsibility to states in some states. California is a Public Law 280 state. And that means when there's a crime on a reservation, the tribal police cannot prosecute a non-native. So they have to wait until the state police get there. And oftentimes this is a challenge because it's a wide, reservations can be very big, and state police want to come on there because it takes a lot of their time. So in a community level, as a result, much as a result of boarding school and fragmented families, we have a loss of language. I did a focus group in San Francisco with community members and was asking about what their understanding of historical trauma, because we use it so much in the field. And many of them said distance from family, loss of language, poverty, no place to live. and loss of social roles. They didn't say this, but many people that have come to the city, they don't have the accessibility to jobs because of lack of cultural understanding of professional roles. So our society was basically torn apart when you take a subsistence pattern away, and the men oftentimes would go to alcohol, and the burden of everything becomes on the woman for the children, subsistence, and that sort of thing. So that impacts at a community level, because as we lose this as a community, we lose hope, and we have many people in poverty. Things have improved somewhat with a lot of our people being able to go to school, higher education, and more are doing that now. But there's still a lot of people that don't see themselves as being able to participate in academia. And as we know, academia is one of the hoops to get through to have civil access to jobs and to have a voice in a platform where people will listen. We have alcohol and drug abuse is such a big problem for Native Americans. Many of us now are 70% live in urban areas now. And alcohol abuse leads to and drug abuse leads to homelessness, as many of us already know. It breaks up our communities. It creates violence in our communities. We have violence from the outside of our community, and we have violence within our community. Police brutality and lack of investigations also contribute to community mental health. Again, Public Law 280, with the missing, murdered, and Indigenous women and children. I'm sorry, I didn't spell that out. I must have rearranged my slides. There's a crisis in this country with missing, murdered Indigenous women and children. There's over 5,000 missing, murdered Indigenous women and children that have not been found or accounted for. And the police, as I mentioned earlier, the police on the reservations, if they may have an idea of what's going on, but they don't have the solid evidence to arrest. Its perpetrators are Native American as well as non-Native Americans. And so this affects our mental health as we become depressed, as our family members are murdered and missing, and families don't know what happened to them. And there's a movement right now among Indian country to find our missing and murdered Indigenous women and children and young boys as well. The family level, the boarding school policies, again, loss of language, it gets transferred to the next. These things, people have maladaptive coping, and that gets transferred to the next generation. Again, the missing, murdered Indigenous women. That happens at a familial level as well. And then individuals, of course, learn from their first teachers, identity formation, coping and survival, and healing resilience, and this all impacts mental health. The next slide, I believe, is going to demonstrate how that gets transferred, how intergenerational trauma can be transferred over the lifespan and across generations. So let's just use boarding school as an example. And in the boarding school, we'll say Tommy is not himself abused, but he can hear the abuse happening to one of his peers. And I've spoken with friends and family about this, and at times they were made to sit in like a classroom setting with one big overhead light sitting at their desks, silent. And what they could hear in the next room was the abuse, the beatings, the screams. And then they would beat you if you screamed as well. So as Tommy gets older, this impacts him and his mental health, and he starts keeping everything inside. He doesn't speak. He goes home, he doesn't speak. He stays in his room. Because in the boarding school, the message was sent to our children that if you talk about and you say anything bad about this, beware for punishment, because you will be punished when you return. Some children may leave for holidays or mainly on the holidays. And if they told their parents what was happening, the schools would punish them. The nuns and the priests would punish them. So they learned not to say anything. And many of them today have a hard time speaking about this. And that's certainly a mental health, contributes to mental health. So what Tommy has done, back to Tommy, he has formed adaptive coping responses, but they're maladaptive. And the way his coping is he's staying to himself. He's not saying anything to anybody, and he's stuffing. So family comes over to his house, and they're looking for Tommy, and they ask his parents and family, well, where's Tommy? We heard he was back from boarding school. Oh, Tommy just stays in his room now. It's okay. Don't bother him. He'll be okay. And so that gets normalized in the family, that Tommy's just way of being is to be to not be social with family, to stay and take his meals in his room and not interact with people. But Tommy grows up and he goes to school that's not in the boarding school. He has a relationship. He gets into a relationship. Now, when there's problems in the relationship, the two people in the relationship will discuss it. But Tommy shuts down. He doesn't talk about it. So his girlfriend goes to his mother and explains that Tommy's not being responsive. There's things we try to talk about. He does not respond. And his mother says, oh, that's just Tommy. Just let it be. Give him a chance. He'll come around. And this behavior gets carried to adulthood. Now, say that Tommy is in a different relationship and he still puts through that, that non-responsiveness. But then what happens, he's been doing this a long time, and he's been stuffing all these emotions and feelings with the root of the trauma that happened back in boarding school. So now Tommy starts to explode. And as Tommy starts to explode, it's either hidden or it's normalized in the family. That's how Tommy is. Then, of course, a new generation is born, and there's exposure all over again, and the cycle continues on. So this is a problem. I would say out of 98% of the people that I see, historical intergenerational trauma has been a part of their family history. Some of them don't connect it, and oftentimes we'll do like a family tree. I forget what you call that, where we go back each generation to try to see what happened the generation before and how the coping mechanism takes place for the current generation. This was a big learning experience for myself. My mother went to boarding school, and having survived her coping mechanisms in growing up, I couldn't figure out what was wrong with our family. Something was certainly wrong. Of course, I was watching TV programs such as Father Knows Best and all those family sitcoms, and was measuring how families were supposed to be against the television programs that they were showing, which was made up. So, of course, as Dr. Reeds had mentioned, that this is multi-layered and intersectional, and it's very, very complex. If you look at the inner circle here, represents the Pacific person or the tribe. These inner layers right here are the different stressors that we're faced with. There's some of these, say, war traumas, policies, suicide, which is pretty rampant in Indian country, boarding school, tuberculosis, diabetes. These are all things that manifest as a result of intergenerational trauma. The government gave us food rations. They were all white flour, white bread, white everything that we know now is very bad on your health. And we have a suicide epidemic in Indian country. And of course, as the diets get transferred from generation to generation, that loss of balanced diet and loss of balance also happens in our families. And this outside is the wheel that I just showed you, this one with the colored arrows. And this outside in the Four Corners area is what we see when we treat people with present-day traumas and complex traumas. There's a sort of spiritual death that takes place, that they may believe in something higher themselves, but they don't practice it. Oftentimes they don't know how to pray. Oftentimes I'll pray in session with my clients as a cultural strength. There's a dissociative process that takes place, somatic numbing, and an emotional masking. Oftentimes people, I can't tell you how many times when I'm in start session and I ask people, how are you doing today? What's your mood like? Oh, I'm okay. I'm okay. But when we get into discussion, they're not okay. I have to take a sip of water, sorry. I got stuck again here. Okay, let's see. I don't know why that got stuck, but I'll move forward without the screen. I wanted to talk a little bit about barriers to mental health. There we go. And as we're excluded from society, there's a phrase that I coined at that hearing in San Francisco about the human rights for Native Americans, and that is discrimination by omission. If you omit us in your evaluations, and you omit populations, then there's no funding resources because you lack the statistics and the numbers to put in for grant applications. And therefore you lack a voice. In the televised media, I'm sure we've all seen lately the case with Gabby Partido and how much news coverage this is getting. And we have, as I said, several missing and murdered Indigenous women that don't even get a second of televised media. And we've seen this before. And, condolences to the Partido family. But can we have a voice too? Can our people be shown on mass media so that these mysteries can be solved as well? And of course, the stigma. There's stigma that gets attached to us as people. We talked a little bit earlier with Dr. Reeves about microaggressions, and I totally agree with her that these are not so micro. There's stigma within our own people about getting mental health services. Historically, a lot of our spiritual leaders were put into mental institutions, saying that the reason being that they were not of sound mind, and the real reason was that our society and social structure would be broken if there's no spiritual leader. What do we hold on to? And again, culturally, as I mentioned, there's the stigma of mental health is people don't want to seem crazy. They don't want to be crazy. I have clients that I've worked with when I try to do screeners with them. They really don't want to do the screeners. And when they do the screeners, they underreport. And then they'll say, many times they'll make a statement, well, I'm not crazy. And I try to do psychosocial education and explain to them, it doesn't mean you're crazy. It means that there's an imbalance. And it means that we have to work on a particular area to find balance in your life. I personally think that people that adjust to the society that we're in now, they probably need more counseling than many of the people that are trying to survive in this society. We have trust issues. We don't want to go talk to a stranger, and we want to talk to somebody that looks like us. So in the least, funding would be needed to take care of us to take care of funding for peer support groups and cultural groups. We are most successful when we have cultural functions, such as a gathering of Native Americans we have And this is where community comes together. There's trained facilitators, and everything is, healing is done through a cultural lens. We bring spiritual people in, we bring our medicine in, and especially in the urban areas, many people are starving for their cultures because they've been distanced. Their family may not practice traditional ways because they did it. They converted to Christianity for survival.
I think this is a good segue for us to begin our panel discussion. I'm really excited to hear more about the experiences that you've already shared, some of which we've only heard in the media, especially with the mass graves and the number of individuals that were put in boarding schools. And so some people have, like myself, I've only recently heard of these stories, and I can only imagine that it has re-traumatized segments of the Native population. So I'd like to thank you so much for sharing your experiences. And of course, we never have enough time to go through everything, but I'd also like to, at this time, welcome Dr. Michael Liu so that we can begin a fruitful conversation about the experiences that you touched upon briefly with Asian hate that has spiked in, I think, throughout the nation and even here in a liberal part of our country in the Bay Area. And Dr. Liu had penned an op-ed blog or a post at the UC Berkeley on their website. And I think it was also published in, what is it called? Berkeley, one of the major Berkeley newspapers. And I found it quite inspirational, but also really informative. And I feel like you really had the pulse of what was going on within the Asian American community here in the Bay Area. And so I'd like to give you an opportunity to provide a brief overview of that op-ed, and then let's begin a discussion between Ms. Maas and yourself.
Great. Thank you so much, Deirdre, for inviting me to speak on generational trauma for Asian Americans. I'm Michael Liu. I'm the Dean of School of Public Health at UC Berkeley. But let me just say up front that I'm really no spokesperson for anti-Asian racism. Really haven't been all that outspoken before. Haven't really fought on the front line for racial justice for AAPI communities. I've never even taken an Asian American history class. So like many of my Asian American friends, my generation, especially first generation Asian American immigrants, the way we dealt with anti-Asian American racism is by keeping our head down, work harder than anyone else to show our worth, to earn our rightful place in this country. I still recall my first encounter with racism. I was 12 at the time, moved to this country 6 months earlier. One day I was riding my bicycle in the neighborhood. I was stopped by a little girl, a little white girl who was shouting at me, and she couldn't be more than 6 years of age. So I stopped my bike, trying to listen to what she was saying. And no, I couldn't understand English very well at that time, but I understood that she was shouting racial slurs at me, making slanted eyes gesture, and told me to go back to where I came from. Years later, I would reflect on this incident and often wonder what could have felt that heart with so much hatred, so much prejudice at such a tender age, and what could have made her feel so privileged on the basis of race that entitled her to put down a stranger twice her age and twice her size. But at the time, I really didn't know what to do. So I just left. I rode away on my bike. I didn't even tell my parents because I didn't want them to worry. And frankly, all I wanted at the time was to fit in, to belong. So for more than 40 years, that's how I and many of my Asian American friends have dealt with racism. But all of that changed this year. after the spate of more than 9,000 reported anti-Asian hate incidents all across the country in the past 18 months, after the shooting of 6 Asian women in Atlanta at the intersection of racism, xenophobia, and misogyny, I and many of my friends realized that we've been wrong. By not speaking up and speaking out, we've contributed to the invisibility of anti-Asian American racism. It's not taught in most textbooks. Until recently, it's not much talked about in the media. But anti-Asian American racism is real. It's always been a stain on this nation's history for more than 150 years, even if we don't always see it. It was there at the Chinese massacre in 1871, the worst lynching in US history, when a mob of 500 white men stormed LA Chinatown, where they murdered and lynched 19 Chinese immigrants, including a 14-year-old boy and a doctor. It was there with the Chinese Exclusion Act in 1882, the first and only immigration ban enacted by Congress in this country, denying them of citizenship and naturalization rights, which then got extended to the Japanese, the Indians, and then all Asian immigrants by 1924, and which wasn't reversed until 1952. So
It looks like we have temporarily lost Dr. Liu.
fought against Germany and Japan to defend our freedom. Deirdre, am I back in real time? Sorry, I was having trouble with my internet.
Yes, you are.
Okay. And it was there in 1982 when Vincent Chin got bludgeoned to death by 2 white auto workers with a baseball bat, who mistook Vincent for a Japanese and blamed him for the loss of their jobs. And despite confessing to their crime, the 2 men never served time. It was there in 2001 when Balbir Singh Sodhi, an Indian American of Sikh faith, was shot 5 times by a white gunman who mistook Balbir for Muslim because of the turban that he wore, 4 days after 9/11. In times of crisis, anti-Asian scapegoating has become an American pastime. We saw it after 9/11, and we're seeing it again since the beginning of the pandemic, inflamed by former President Trump's racist and xenophobic rhetoric about the Chinese virus or Kung flu and spread by his followers, even as many AAPI frontline workers put their lives at risk every day to protect the public's health. But anti-Asian American racism doesn't always make the headlines. It comes in many, many forms. We're made fun of for the way we look, the way we drive, what we eat, what we wear, how we speak, how we parent. It's in the fetishization of Asian American women and the desexualization of Asian American men. It's in the way we're treated as a perpetual foreigner, getting that question, where are you really from? No matter how many years or how many generations we've been in this country. I recall my first Thanksgiving dinner with my wife's extended family before we got married. My wife is white. First of all, there was a grandma who called me a Chinaman all night long, but everyone just kind of laughed it off because of our age and dementia. Then there was my wife's aunt who was trying so hard to be inclusive of me in the dinner conversation. But the only thing that she could think of to ask me in front of everybody was, why did Chinese men bind the feet of their women? Now, I was 35 at the time, having spent twice as long in this country as I did growing up in Taiwan, been naturalized since I was 18, got national recognition for the work that I've been doing on women's reproductive justice. And yet somehow she still thought that I would have a closer connection with 19th century Qing dynasty misogyny than I would have with 21st century reproductive justice in America. So a perpetual foreigner, a guest in my own home. And lastly, it's really in the way that we're stereotyped as the model minority. And by the way, that's really no accolade. Now, I know what some of you are probably thinking. right? You're the dean at the #1 public university in the world. Some of your colleagues are some of the top doctors, lawyers, and CEOs in this country. You made it in this country. How can you complain about being a model minority? Well, I'll tell you 3 things that are wrong about the whole model minority movement. First, by lumping all AAPIs together, it obscured the fact that many in our communities are struggling. So for example, it masks the poverty rate of 29% amongst Burmese Americans and 22% amongst Hmong Americans, compared to less than 12% amongst all Asian Americans. Without disaggregating data for AAPI groups, the needs of many of our diverse communities will remain invisible. Second is that by pitting us against other BIPOC communities, we become a convenient rationalization for white supremacy. The argument goes something like this. Look at the Asian Americans. They also face racism, but with hard work and family values, they've been able to overcome it. So racism has nothing to do with the persistent struggles of Black and other communities of color, ignoring that many AAPI communities also struggle because of structural racism. But what this does is that it pits the AAPI communities with other BIPOC communities and has fueled anti-Black racism amongst Asian Americans and anti-racism amongst African Americans that erupted in the LA riots and persists today in many marginalized communities. Third is that the model minority connotes all sorts of stereotypes about Asian Americans that reduce us to these unidimensional, overachieving, almost robot-like caricatures, capable of rocket science and neurosurgery and all the hard technical stuff, but incapable of soft skills like leadership and management, communication and negotiation, emotional intelligence, capable of working hard and following directions and getting the job done, but incapable of full expression of our humanity, including vision and judgment, strategy and creativity, and all the other qualities that are required for organizational leadership. And that's when we get up to a certain level, we bump up against that glass ceiling, what some in our community refer to as the bamboo ceiling, pass over for promotion or even training opportunities. And that may explain why Asian Americans make up 27% of the professional staff at the top 5 companies in Silicon Valley, but only 14% of executives and 2% of Fortune 500 CEOs, 11% of law firm associates, but only 3% of partners, 10% of federal workforce, but only 4% of senior executives in federal government, and 7% of tenured faculty, but only 3% of deans, and 1.5% of college presidents. So let me just close by saying that I can't tell you how much it has meant to me after I started speaking out against anti-AAPI hate, to have so many of my non-AAPI friends and colleagues reach out to me to say, I see you, I feel your pain, I stand in solidarity with you. Many of us are just beginning to learn how to speak out about the generational pain and trauma and racism that many in our community have endured for years, for decades, and for generations. I appreciate having this forum to talk about it with you. I appreciate you including the Asian American experience in this conversation about healing generational trauma and advancing health equity and racial justice in our nation. Thank you very much.
Thank you so much, Dr. Liu. You know, one of the trends that I noticed in all 3 talks is that all 3 presenters, of course, representing your own personal perspectives and not speaking for an entire race of people. So we do acknowledge that. But one of the things that I noticed was that there was lots of talk of not just generational trauma, but intergenerational trauma, this trauma being passed on because it's normalized. And I really did appreciate the schematic that you provided, Ms. Maas, that showed how that experiences of trauma are transferred from generation to generation. And so, yeah, I did want you both to speak to that, but then also the other thread that I saw that kind of went through all 3 presentations was this concept of fitting in or acculturation and how how acculturation can ultimately affect one's mental health in a negative way. When you finally feel like you have reached the pinnacle of fitting in and acculturating, in fact, you have lost all the coping mechanisms and strategies that were inherent in your culture. And so if you could both address those issues, it would be great.
Thank you, Deidre. And thank you, Dr. Liu. I really enjoyed your presentation.
Likewise.
Thank you. Thank you. I think to speak about the fitting in part, I'd like to talk a little bit about that. And I think that for Native Americans, that it occurred and still occurs, but primarily intergenerationally, like the generation before me, my mother's generation. She came directly off the reservation and experienced a lot of hate, which is in the urban areas, but not so much for urbans as it is on reservation land. When you get closer to reservations, there's a lot more racism that occurs. And so she had been exposed to that face to face, and so she opted to fit in. She actually, when she went to boarding school, my mother's fair complected, as am I. She was favored by the staff at the boarding school because she did not have dark skin. And this set a dynamic where she wasn't liked. And she didn't, so she went to school to be able to get civil access. She had no home to go back to. She was orphaned. So she needed for survival to get civil access. And in order to do that, she had to fit in. And when she first came out here, she said she was Italian. She didn't acknowledge her Native ancestry. So I think different people in different generations, I think there are other people that feel less than from maybe they don't have college educations, or they don't have the ability to speak publicly. And so they try to strive for maybe the internal dialogue is, I'm not good enough. I'm not worth it. And they try to keep getting better and better and better. So their goal is to get, and oftentimes I'd like to also say that members have been distanced from their culture and they don't think they belong in Indian country. And this was part of the master plan goal of the federal government, is that Indians would disappear one day, but it didn't work because our cultures are strong. And when people get exposed, when people hear that drum for the first time, it calls them home. So it sets up a pattern for failure, because most people aren't going to get the top jobs. They're going to get medium range job or lower medium range jobs. It's the exception that really strives to finish that education that is really the gatekeeper for well-paying jobs. I'm going to stop there just to give Dr. Liu a chance, because I can go on, and I want to give fair time.
Yeah, just on the question of intergenerational trauma, we certainly know that intergenerational trauma can be transmitted through early childhood experiences. A lot of what we've been learning around adverse childhood experiences have demonstrated that. I'm an OBGYN. I spent 20 years of my career studying how intergenerational trauma could also be transmitted inside the womb through the stress that women experience, including the stress racism, which then can cross the placenta and during critical periods of development could influence the hardwiring of the fetal brain and influence epigenetic modification, which then could have long-term health and developmental consequences. And so certainly, yeah, there is a growing evidence supporting intergeneration transmission of trauma. In terms of acculturation, I also think that there's a price you pay for acculturation. And again, there's lots of literature in public health to demonstrate that. In my field in maternal and child health, we know that acculturation is actually associated with the loss of a lot of health advantages that, for example, and Latinx populations enjoy. In fact, there's a study that was conducted in Berkeley that showed that simply living in the United States for more than 5 years, it basically wipes out all the advantages in birth outcomes that Latinx populations traditionally enjoy. So there's something about living in the United States and trying to fit into this culture, and whether it's the loss of that traditional social network, social support, or whether it's just the experience of racism and racial discrimination that really takes away those protective factors that you would traditionally enjoy.
I have a couple more questions for you all. Ultimately, although we present a lot of this information, and some of it, is we're providing the history for our students and participants who may never have been exposed to it, and of course the perspectives. But what I'd like to do is segue towards solutions, the kinds of strategies that we can put in place, policies, what we can do as individuals, but then also what we can do can support the strategies that would change much of the structural racism that may exist, that perpetuates the racism and the internalization of these racism, and ultimately can be passed from generation to generation. But then what other kinds of kind of subtle policies to address microaggressions? What things can we do? What actions can we take as public health practitioners to address this, so ultimately we can have better mental and physical health outcomes?
Ms. Maas, do you want to go first?
I was deferring to you, and then I'll go after you because I can be long-winded, but I'm happy to go first. Thank you.
Sure. Why don't you go ahead and go first?
Okay. I think one of the first things that we can do is creating awareness. And how do you create awareness for people, for ears that don't want to listen? That's the challenge we have. And so I think that there are various mediums where we can make that change. We're seeing it with the youth. We're seeing it with poetry, spoken word, applied with music. We're seeing that. And I think that that's a very good venue to combat microaggressions, racism, because it brings it to the forefront. And the youth are our answers today. I think there's hope with the youth. We saw so much help from across the board with many, many people of color coming to the Dakota Access Pipeline a couple years ago up in North Dakota with the oil factories and lines. So we saw a lot of people of all races and nationalities coming to support that cause, because that's a human cause. It's a life cause. If there's no water, there's no life. And so I'm hopeful because I see that in the generations. I saw people of all colors marching after George Floyd was murdered right on national television. And that's hopeful for me. I hear conversations of young people. So those are some of the, creating awareness is the first thing. Acknowledgement, trying to get an acknowledgement, but I think we need to be persistent in getting an acknowledgement of the history that's happened. I'd like to see acknowledgement for the Native American community. I see San Jose made an acknowledgement for the Asian community yesterday on television. I saw that, and I think that there's a lot of abuse that's taken place. That book, I don't remember the author, you probably do, This Bridge Called My Back. that this nation was built on people of color, and it's time for mainstream to acknowledge that. But it takes all of us. It takes all of us, not only people of color. We need allies, and we need allies that are not going to step into the front, but will walk alongside us. So I'll stop there for now. That's a good place for me to stop.
Yeah, and I'll just say, I think a good place to start is to make sure that we're actually walking the walk and not just talking the talk. And so in the aftermath of George Floyd's murder and the national and global reckoning with racial injustice and racism, my whole community, the School of Public Health at Berkeley, we all came together and we resolved to become more anti-racist as a school. So over this last year, we've done quite a lot. We had mandatory anti-racism training for all faculty, staff, students. We launched an anti-racism faculty academy. We created new anti-racism courses for our students. We took a hard look that we really could re-examine all of our policies, procedures, and processes, including our contracting and purchasing practices. So there are a lot of things that institutions can do to make sure that we're actually becoming more anti-racist. That said, I do think that this really has to be addressed at a societal and global level. And I think that what we really need to learn is how do we dismantle institutionalized racism. And this is kind of where I spent the last 20 years going around the country trying to help communities like Flint and Ferguson and Baltimore address their high rates of maternal and infant mortality. And when you go into like these community meetings, when you really listen to community voices, it was pretty obvious what's really driving the high rates of maternal and infant mortality is the institutionalized racism that's manifest not only in differential access to healthcare and or prenatal care, but in differential access to education, housing, jobs, safe, healthy conditions, the conditions that assure that all women, families, children can be healthy. And yet, those of us who are trained in healthcare, those of us who are trained in public health, we don't know what to do with institutionalized racism. And so we end up doing the same old thing, right? We go back to the easy stuff, enhancing prenatal care, supporting care coordination. But I think if we really want to do something about achieving health equity in this country, if we really want to do something about addressing disparities, we got to do a lot better in terms of dismantling institutionalized racism. And we got to make sure that we're equipping the next generation of public health professionals, of healthcare professionals with the knowledge, the tools, and skills to dismantle racist institutions, and whether that's in healthcare, whether it's in public health, in community, in society, and globally.
Thank you so much for both your contributions. And I really appreciate the fact that you've both bluntly highlighted what we need to do. I think sometimes when we say that we need to address racial issues, a lot of academics in particular shy away. But I think that there is plenty of knowledge and evidence at this point that not only does racism exist, but it has a profound impact on our health and is at the root cause of many of the poor health outcomes that we experience as people of color. And ultimately, because we're all connected, our health matters to one another, and the health of each community matters in order for us to be a healthy society. So I'd like to thank both of you all again for participating in this session. And of course, I'll probably invite you again to further these talks at some time. And I appreciate your perspectives. So this concludes today's session. It looks like you have lots of thank yous and agreement with your perspectives. We're going to conclude today's session now. And again, I appreciate your participation in the 7th Annual Social Justice Speaker Series.
Thank you.
Right.